My name is Joe Malash, and I'm the superintendent of the Cherry Hill Public School District. Welcome to our first virtual town hall meeting. Thank you for willing to spend about 90 minutes with us this evening to have some discussion, to answer questions, and to get some more information about where we are as a school district in terms of hybrid instruction and direct instruction for our students. This has certainly been a tumultuous and challenging last week, and honestly, a challenging last 8 months for many of us. So I appreciate you being willing to spend some time as we go through and have a discussion this evening. There are a number of people that are on this Zoom call with me. I'd like to go through and introduce and have them actually introduce themselves. I'm going to start with our Board of Education President, Mrs. Lisa Seidel.
Thank you, Dr. Malash. As Dr. Malash mentioned, my name is Lisa Seidel, and I'm the current Board of Education President. Thank you so much for taking the time to join us tonight. I would be remiss if I didn't acknowledge how difficult the past 8 months have been, particularly for our parent community. As a working parent, I know firsthand how challenging the return to learn plan changes have been on families trying to balance home, work, school, all during a pandemic. Tonight, we will answer many of your questions, address your concerns, provide perspective on how past decisions were made, and insight into how future decisions will be weighed. On behalf of the Board of Education, thank you for your continued feedback. We are appreciative for the emails and messages sharing your perspective. While it is difficult to please everyone during these challenging times, one thing we can all agree on is the safety and security of our kids is a primary concern. Again, thank you for participating this evening, and I look forward to your questions.
Thank you, Mrs. Seidel. Now I'd like to introduce our Board of Education Vice President, Mrs. Lori Neary.
Thank you, Dr. Malash. Again, I want to echo what Ms. Seidel has said. I thank everyone so much for joining us again on another weeknight. If you've joined us previously or for the first time, I appreciate you taking the time. I'm not just board vice president. I'm a mom with 4 kids in the district, all of which have varying degrees of special needs. So I truly understand what many of you are facing. And I just want to let everyone know that we hear you, we're listening, and we appreciate everyone's feedback and perspectives, all of them, good, bad, indifferent. We want to hear it all. So I appreciate you coming out, giving it to us. We're listening. I want to thank the staff at all our schools for all of their hard work. I know it's been incredibly trying since last March. And you know, you're showing up to your job every day with a smile, and our kids are seeing it. So thank you. Your dedication and hard work is appreciated. Administration, very much appreciated. So thank you. Be safe, stay well, and thank you for joining us.
Thank you, Mrs. Neary. And next, the President of the Cherry Hill Education Association, Mr. Steve Redfern.
Good evening, everyone. I'm Steve Redfern, the president of the Cherry Hill Education Association. My wife is also a kindergarten teacher in the district at Woodcrest Elementary School, and both of my children attend the Cherry Hill schools. My daughter is a 4th grader at Clara Barton, and my son is an 8th grader at Dr. Birdie's school, Carusi. Good to see everyone.
Thank you, Mr. Redfern. Next, Dr. Neil Birdie, the Cherry Hill Association of School Administrators Vice President, and, as Mr. Redfern mentioned, the principal at Carusi Middle School.
Thank you, Dr. Malash. I appreciate it. And Mr. Redfern, what a perfect segue. So my name is Neil Birdie. I am principal here at Carusi Middle School. I've been in the district for nearly 20 years as a teacher and a coach and a principal at all 3 levels. Formerly the principal at Bret Harte, and before that, the Cherry Hill Alternative High School. I'm here tonight in my capacity as a principal, but also I'm the vice president for the Cherry Hill Administrators and Supervisors Association, and I appreciate the invitation and the opportunity to be here.
Thanks, Dr. Birdie.
Thank you.
Next on our panel, this is Jennifer DeStefano, the SAC from High School East. Mrs. DeStefano.
Good evening, everyone. I'm Jennifer DeStefano. I am the Student Assistance Counselor at High School East. I have been in the district for 19 years now, and it's a privilege to be with all of you tonight.
Thank you, Mrs. DeStefano. Next, Mrs. Barbara Case Abner. She is the nurse at Beck Middle School, and she is also the district lead nurse, which means she assumes responsibility for all 22 of our school nurses. And as Mrs. Case Abner starts to introduce herself, I'm going to put up just a little image.
Good evening, everybody. I'm Barb Case Avner. I am the school nurse at Beck Middle Schools, and I'm also the district lead nurse. So I've been with the district almost 15 years. And while I'm up here, I'm just going to review with you what we're going to ask you to do before you send your students into school, starting tomorrow going forward. So we're asking all staff and students to screen at home before coming to school. This screening tool that Dr. Malash has up for you can be found right on the CHCLC website on the main page. We're asking you to take a look at this every morning. You can print one off, leave it on your refrigerator, and review it every morning before you send your child into school. The nurses will be looking out for your children, as well as the teachers and all of the staff in school, so that we maintain safety for everybody. But it's a team effort between the parents, guardians, and the staff in the school. So if you're taking a look at the tool at the section, you notice two categories. If your child has any two symptoms from category A, we're going to ask you to keep them home that day. If they have any one symptom from category B, we're going to ask you to keep them home. If you're keeping your child home for these symptoms, it's a good idea to follow up with your healthcare provider, let them know what's going on, and take direction from them. It's a pandemic and we cannot be too careful. And then if you look down to section 2, if your child within the last 14 days has had close contact within 6 feet of an infected person for at least 10 minutes, and the parameters for close contact have changed, so that 10 minutes could be over a 24-hour period, so it could be cumulative, with somebody who has tested positive for COVID, then you want to keep them home and follow up with your healthcare provider, because you might be in a situation where you'll have to quarantine your student. And if you have a question, reach out to your building school nurse and she will guide you through the process of what to do. The nurses in the building are the experts that you're going to want to touch base with. If someone in your household is diagnosed with a lab-confirmed COVID-19, you're going to want to keep your student home. The new guidelines on quarantining for that is 24 days. So that's something you're going to want to discuss with your health department contact when they call you to discuss that, and your building school nurse. So it's a team effort between you and your building nurse. And if you've gone or traveled to any of the high community transmission areas, and I believe there's 45 states on the list now. So if you've traveled to one of those states, or if you're planning on traveling over the Thanksgiving holiday, then we ask that you keep your student home to quarantine. But I want to make it clear, if you keep them home to quarantine, that does not mean they're missing instruction. It just means that they're going to flip into the remote section until they're safe to come back to school, because it's incumbent on all of us to keep each other safe at this time. So we're asking parents to be responsible with this. And so if any of the fields in section 2 are checked off, your child stays home from 14 days from the last exposure. The only little change in there is if you have an immediate contact at home, and that could be up to 24 days. Your child's quarantine period begins when the infected person's 10 days from the start of their symptoms, and that's where they get the 24 from. But we can always, your building nurse can clarify that for you if you have any questions. So just be mindful. Please fill out the survey every day. I'll be filling one out for myself. All the nurses will, every staff member will, and we're asking that you fill it out for your children. And when in doubt, keep them home and let them learn remote that day. And if you have any questions and you feel that you need them answered, feel free to reach me in my office at Beck between the hours of 7:45 and 3:15, Monday through Friday. Thank you.
Thank you, Mrs. Case Abner. I appreciate that background. Excellent. And again, for everybody that is on the website, that document can be found on the website. All right. We are also, I'm optimistic that we will have one other person joining us. I invited Dr. Pascal Nawako, who's the health director for Camden County. We made the initial overture last week and have invited him a number of other times during the course of today. I know things have been very busy down at the Department of Health. Hopefully, if he's able to join us, then he will come on. Also on the call, where you can see the names that are on the screen, are some of the other members of Superintendent's Council. This is Koya Weathington, who's the Director of People Services, Dr. Farah Mahan, who you'll see later in the evening, who's our Director of Curriculum, Ms. Nancy Adrian, who's the Director of Human Resources, Mrs. Barbara Wilson, who's our Public Information Officer, and Mrs. Lynn Sugars, who's the Business Administrator and Board Secretary. They will be on, should there be any questions that come along for them to answer. Just in terms of our format this evening, I do want to talk just briefly about what's going on during the course of the past week. And as I said, we'd like to focus more on the past week than on the past 3 months or the past 8 months. It's much more pertinent to where we are today and where we are moving forward. We've received since last Friday evening about 95 questions that were submitted in advance. Some of those questions match up thematically, so we'll be addressing those as we go through this evening. I don't know that we will get to all 95 of these questions. We would like to take questions during the course of the evening, also from people who are logged in. And at this point in the evening, there are about 1,400 people who are on the Zoom call watching. Certainly not all 1,400 people, if they had questions, would be able to ask them either. We will post an FAQ beginning tomorrow afternoon that's a follow-up from this meeting. This meeting will also be posted on our YouTube channel, and it'll be archived so folks will be able to watch it. So let me just talk a little bit about what's been going on during the course of the last week. And I will just give a little contextual history. So this past Friday, November the 13th, was officially 8 months since we've had students in school on a regular basis for learning. March 13th was the last day that we had everybody in school together during the 2019-2020 academic year. When the governor announced in May that schools would remain closed for the rest of the academic year, we began to talk about and plan for transition back into school. A great deal of time, effort, and work went in during the course of the summer. We had more than 80, mostly volunteers from our staff who were involved in building the We Return to Learn plans for our different levels, for Barclay, for the elementary level, the middle school level, and the high school level. Lots changed during the course of the summer. A lot of information came out from the state, and a lot of questions then developed. We expected to open in a hybrid model on September the 8th. We delayed that opening of the hybrid model and pushed that opening back to this past Monday, which was November the 9th, for the beginning in a collaborative learning day with the beginning of the launch of the hybrid schedule. We expected students to begin last Tuesday, November the 17th. Part of our responsibilities as a public school district and the guidance we receive from the state of New Jersey, as well as in our plan, is that we must use, communicate with, and rely upon the Camden County Department of Health. They're the public health, the community health experts in Camden County. That's who we consult on a daily basis should we have questions about quarantining, questions about positive cases, whether it involved our students, our student athletes, or our staff. Last Monday afternoon, following a phone discussion with the County Department of Health, they followed up with an email making that strong recommendation where they said they make the strong recommendation that we not bring children back to school on Tuesday, which would have been November the 10th, just about a week ago. And why was that concern there? So, and this goes in honestly preemptively into some of the questions. In the discussion that we had with the folks from the County Department of Health, they identified about 36 new COVID positive cases in children between the ages of 7 and 18. 36 cases that had come in from Friday evening throughout the course of the day on Monday. They had not completed contact tracing. They had not gone through and made the calls they needed to go. And through the cautious steps that they were taking, the recommendation was the school district not bring children back in on Tuesday. By late Tuesday afternoon, so this is from Monday, November the 11th to Tuesday, November the 10th. Again, in follow-up discussion with Dr. Nowako, who's the Director of Health for the county, they had completed the contact tracing for those 36 children and had made the determination that it was going to be safe for us to be able to bring children back. That's why we made the announcement on Wednesday that we would look to launch the hybrid schedule this week, beginning again today, which was a collaborative learning day throughout the district for students to return tomorrow on November 17th. In the information that I shared last week, I included the emails that we received from the County Department of Health when I sent the information out with the community on Wednesday. And I included those because I think it is important for folks to see what it is exactly that we receive. So again, this is the email that we put out. This was the message that I received from Dr. Nowako, who's the county health officer and public health coordinator. Again, referring to what had taken place in terms of the contact tracing, the concern that had arisen because of the spike in cases where they were. And then again, the recommendation in the second paragraph, we found the influx of cases are not connected. The cases can be excluded from the school if the school district had resumed in-person instruction today. That's why there was the change. Again, with the fluidity of what goes on with the information and the change with the positive cases that exist, our primary responsibility as a school district, again, is to look at health and safety, and we must look at what we are being told by the County Department of Health. The other email that we received this was the email from Monday, from the 9th. Again, references phone conversations with a couple of the nurses. For context, Dan is an epidemiologist with the Department of Health. So again, that's how the decision, that was the one of the overarching and overriding and overwhelming pieces of information that we have to consider when that determination was made last Monday, and then when the announcement was sent out last Wednesday to begin children to be able to return this week in the hybrid schedule. Our goal is and has been to be able to safely return children to the district because we know the difference and the impact it can make when children and our staff members are in school together. We know that our teachers have done an incredible job, and you'll probably hear me say this throughout this evening, but when you look at the staff members that we have in our district, they have done an incredible job to maintain a level of education and expectation and communication and interaction with our students and with our families. This has been an immense challenge. I realize that for people throughout the community. And I understand the heartache and the challenge that has come with it, and especially the disappointment as we have had to push back the return of children to the schools. So we are trying to work forward to get our children safely back into the buildings. And we are ready for the hybrid schedule to begin tomorrow as we welcome the cohort A students back into our schools. Now, I do want to share with you, again, because people have asked, about the number of students and what it's going to look like in the schools. So when we look at the overall enrollment, let me start with this down here, with where we are. This is how we break out with expecting children in schools this week. 62% of our elementary school students are coming on hybrid, 38% on remote, 57% of our middle school students on hybrid, and 43% on remote, and 50% of our high school students on hybrid, and 50% remote. When we look at that overall as a district, we're at 50, again, closer to 50%, I think it's about 53% on hybrid and 47% remote. There are differences across the schools in terms of the numbers and in terms of the percentages. Some schools have much higher rates of hybrid, some schools have much higher rates of remote. When we look at the overall piece with the hybrid schedule, we can expect about 25% in round numbers of the students assigned to a school will be in school on any of the hybrid learning days, about 25% of the students. So if you take our largest school in the district, which is High School East, we're slated to have 1,028 students on hybrid instruction at High School East. That means on any of the 4 days of hybrid instruction, we're going to expect about 507 students, 514 students who are going to be in the building on a daily basis. Now, as we've moved through this and as we've gone through the discussions, there's been additional training has gone through for our teachers, additional materials, our technology department, our colleague teachers, our teachers working together, folks in the community. We've had college professors, we've had other folks reach out and offer support and information as we prepare for children to come back. There is absolutely going to be a learning curve for everybody involved when hybrid instruction begins tomorrow. There's going to be a learning curve. And I'm asking for parents and for our students that there is grace and patience, that you continue to show that for our staff. Again, our staff has worked incredibly hard to prepare themselves, but it still is going to be new. There are still going to be new feelings of being in the classroom, teaching children in the classroom and children online at the same time. But we are going to get through it. They are going to get through it as we move through together. All right. I think that is all of the background. Yes?
Yes.
As I look at the other people on the panel. So now let's go through some of the questions. And again, as I said, we've had about 95 questions submitted between Friday evening and late this afternoon. Mrs. Wilson did stop picking messages up a couple of hours ago, and we will try to go through as many as we can because we would like to be able to get to questions directly from people who are watching online. All right. All right, Dr. Birdie, I'm going to ask.
Oh, do you want me to tell people how they can?
Now, you know what? We'll go through about how to raise their hands and that kind of thing.
Got it.
Let's get through some of these first. And
Got it.
Thanks, Lisa, for asking. Good questions. Dr. Birdie, I'm going to ask you to start with, there's a question in here from a community member, Mr. Brown, that says, what specific COVID-19 preventive measures are in place to provide a healthy environment each day the building is occupied?
Well, thanks. That's actually a great question, and I'm happy to answer it as completely as I can. I'm sure that there are many more measures that have been taken to mitigate transmission of risk, but let me at least try to name a few that come immediately to mind. First and foremost, just the awareness of the self-screen. We have made sure that all of our messaging, both to our families and to our staff, have been clear about the importance of self-screen every day. We're looking at the We Return to Learn plan, specifically in terms of reducing the amount of visitors we have each day here at Carusi, and I'm sure other schools are doing the same. You've already made it clear Dr. Malash, that there is certainly a much lesser population present on a day-to-day basis, and Carusi fits right into that scheme with about 25% each day. We expect probably about 250 or less children here on any given day. In addition to reducing visitors to the building and running at about 25% capacity, we're requiring masks from everybody who enters the building. That includes visitors who are also screened at the door. That includes every child, every faculty member, every staff member, our administrative team. We expect that masks are worn, and we expect that good hygiene, hand hygiene is being practiced daily. Each of our classrooms have a hand sanitizer and wipes, and we have the custodial staff checking those and maintaining those daily, just to make sure that there's no shortage of PPE in classrooms. We've also created at the middle level a schedule where teachers are primarily moving. So we're looking to reduce movement in the hallways by our children as much as possible. So of course there are anomalies, and we don't have the ability to run it as purely as the elementary folks do. But at the middle level, we're greatly reducing the transitions daily and period by period by asking staff to move and attempting to keep children in one location for the majority of the day. In those classrooms where kids report first thing in the morning, we're also asking them to bring everything they can in their backpack, everything they need for the day, so we can eliminate the use of lockers. And we're also keeping desks 6 feet apart inside classrooms when possible. Desks will be 6 feet apart. I think finally, I mean, there's pretty comprehensive cleaning procedures that are in place, especially in regard to hard surfaces. And those are maintained both by the daily daytime custodial staff, and then some more intense, deeper cleaning going on in the evenings by our night staff, which includes misting. So again, it would be impossible for me to name all of the mitigation strategies that are being used and preventative techniques that are being used at each of the 19 schools. But I am confident that there are many in place, and they are all intentional and deliberate.
Thank you, Dr. Brody.
Thank you.
I see that Dr. Nawako has been able to join us. Dr. Nawako, it's Joe Malash. Can you hear me?
Yeah, I can hear you.
Good evening, Dr. Nawako. Thank you for taking some time. I know how busy your schedule is and everything that's going on in Camden County right now. Dr. Nawako, so we are on with the panelists as the information that I sent. Would you mind taking a couple of minutes just to share with folks how your office, what you do when you find out about a positive result, how you make determinations about quarantine, how you make determinations about recommendations? Can you just talk a little bit about the experience and the background and the role that the county health office plays?
Okay, good evening all. I just got out of another meeting 15 minutes ago. So we've been very busy at the health department. If we get a positive test results from the lab, it's usually from the state lab, we go into contact tracing and case investigation. All the positive test results, even if you go to the emergency room, you go to the hospital, you go to your primary care physician, you go to the urgent care, we all get that test results in our system. There's a lag time between 24, 48 hours, sometimes 72 hours for us to get that test results, but we do get it. As soon as we get it, we contact the person, and we start our contact tracing and case investigation. But we tell the school system to listen and make sure that students or parents or even staff members inform the school system of any positive or any close contacts, so that they can report this to us before we even get to them. That way we cut off that lag time between the time the test result is reported into the CDRSS system and the time we start investigating these cases. So this is the process that we go through every day, trying to investigate cases. When we get to a positive case, we let the person know that the person should be isolated for 10 days. If we get to the close contacts, we let that close contacts know that they should be quarantined for 14 days. And sometimes we get to family household contacts. Their quarantine period is 24 days. If they cannot safely quarantine if they cannot quarantine away from their family members, so it goes the 10 days for the positive person at the home. When it ends, when that 10 days ends, then the 14 days of the close family contact, which is the household contact, starts. So 10 plus 14 is 24. That's why household contacts end up going through quarantine for 24 days instead of 14 days or 10 days for the positive case. So I'll stop so far. We've been working very well with Dr. Meloch and the other superintendents in the county, and they can reach out to the health department. We have contact tracers and case investigators and staff members. Like, no health department was prepared or is prepared for this kind of pandemic and the scale, but we are trying as much as we can. We're bringing up new staff members to the health department, and we're training at a fast stage. But at a point, we went through the first phase. This is the second phase, and we're making sure that everybody is on the same page regarding what we're doing. We've received information that sometimes contact tracers, because there are about 60 of them, they don't all live in Camden County. Some of them live up north, but that's what we get from the state health department. And everybody's on the same page, even if a contact tracer is calling from Bergen County but works in Camden County, but it's still our contact tracer and they all work for us. So we are very happy that we get people that are here to help us out, do contact tracing and case investigation. So let me stop so far. I might have to answer other questions. Thank you.
Thanks, Dr. Nwako. Here's Dr. Nwako, follow-up question that somebody had sent in. It says, what data is the school district and Camden County Department of Health basing their decision to reopen on? Is this data readily available in the public spectrum? So I think this refers back to last week with the change. Originally we weren't bringing kids back. We announced on Monday, and after the contact tracing had been done. So the question about, is the data readily available that the Department of Health uses?
So the Department of Health, we use the guidelines from New Jersey Department of Health regarding schools and regarding schools going back. We started working on the Board of Education, New Jersey Department of Education, return to school guidelines from June. And then New Jersey Department of Health came out with their own guidelines. It's specific on what schools should do if they have an outbreak or if they have higher amount of cases that are all linked together. It also is specific on what schools have to do to report cases, which Cherry Hill School District is doing now. What I can say is that the health department, our role here is to advise and to give directions on cases in Cherry Hill school system. But our role is not to send the school to a remote learning, full remote learning, hybrid, or in person. That is the job of the school district board and the school administration to make that decision. So going back to the question, every decision that we make is through the guidelines from New Jersey Department of Health. Thank you.
Thank you, Dr. Nwako. I think there's another one for you.
Dr. Nwako, this is Lisa Seidel. I'm the Board of Education President. Thanks for joining us tonight. Kelly Gasly, a parent, asked a question that I'd like to ask you. And this is related to the original communication that was sent to Cherry Hill on November 9th. Why does the public data released by the Camden County Department of Health show far less, about 1/4 of the 36 cases that were cited on November 9th?
Okay. So my understanding is that my staff was in communication with Cherry Hills School District, and we saw 14 cases that came up over the weekend. But there was other cases that was going on in Cherry Hill, but our interest was drawn to that 14 new cases. And that was why we recommended that the school don't open the next day to give us time to look at all these cases. And then after we looked at it with the help of the New Jersey Department of Health, we arrived at a decision that the Cherry Hill School District is doing all they can. They're doing contact tracing, case investigation. They're able to exclude all those students from classes so that in person, if the school district decide to open, go in hybrid or in-person learning, that they can still do that, excluding those ones that close contacts and positive cases that came up over the weekend. So what people have to understand is that when you have a positive case, you might have one positive case, but you might have a lot of close contacts attached to that positive case. So the difference between 14 people and 36 people might be positive plus the close contacts. At the beginning of the pandemic, we ran into a person that is an A host or A hostess. I forgot that it's one person, but we had 427 close contacts. So, but from one case. So it's difficult, but that's what we go through every day in the health department. So if that would be the difference between the number that you are talking about.
Thank you.
Thank you, Dr. Nowako. All right, I'm just going to start going through a couple of the other questions. So this is a question that came through, represents several questions on this topic from Jenna Marco. If we originally chose the hybrid learning for our child, can we switch to virtual due to the increasing positive COVID cases? The answer is yes. If you chose hybrid, you may switch to virtual. Please contact your building principal. If your child is on hybrid and there occurs a day that for whatever reason your child cannot make it into school, please have them log in, because again, the children who are on remote instruction will be able to log in. It's live instruction that's taking place. If they log in, they will be marked present. If it's going to be something that's more than just an individual day, please contact your building principal. From Nidra Wilson, this question I believe we answered is about what happened between Monday the 9th and November 11th, we've talked about. Another one from Rosa Sebastian, why try to open the schools in person? Because now is growing the cases of infections in the area. Another reason why I think it's dangerous, because two big holidays are coming, Thanksgiving and the holidays at the end of the year. So again, our primary focus in trying to return students to school or allow students, for those families who choose to come back into school, is to give them an opportunity to physically be in the building. We have students and programs, some of our youngest learners, some of our most vulnerable learners, some of our children in self-contained classes who expect to be in school 4 days per week, that we want to be able to get those programs going in school. If we can get them going, if we can have them going, it gives us a lot more options to be able to meet the needs of those neediest learners and some of our most vulnerable learners and some of our newest learners that are in the district. And again, if we can do it in a safe manner. That's why we continue to work with Dr. Nowako and his staff. A question from Janine Stapleton, again, representing a number of questions that came through on this. Why is hybrid learning moving forward when CHOP has recommended that all schools in the area stay virtual? Thank you. So we took the information from Policy Lab at CHOP. That is one piece of information that we look at. Different areas are doing different things. Montgomery County in Pennsylvania is doing one thing. Bucks County is doing another thing. We have read through the information and the recommendations that they've made. Again, we continue to use the New Jersey Department of Health and the Camden County Department of Health. Dr. Nowaka, do you want to say anything about the CHOP recommendation?
I have nothing to say about it. Like I said, we know that there is the infection rate in Philadelphia is higher than what it is in Camden County, and that's why we, even though we are here in the South, but our numbers look like Essex and Union and Passaic counties because of what's going on in Philadelphia. I do understand what CHOP their recommendation, but still, it is. We are working with New Jersey Department of Health, and we've made our recommendation known to them, but they're telling us this is individual district decision that has to be made as to if schools will be will go hybrid or if they will go in person or remote, full remote. So we respect what CHOP is saying, and we do understand that there are a lot of infection around the Philadelphia area, which translates into Camden County. Yeah.
Thank you, Dr. Nowako. Mrs. DeStefano, there's a question about resources for students that are struggling with mental health and being overwhelmed and upset because of the changes and what's going on. As our SAC counselor, can you talk a little bit about, and I know that you sent me slides ahead of time, which I can put up, but can you talk about what resources are available? To whom can parents reach out? To whom can students reach out? And how to do that?
Sure. Thank you, Dr. Malash. If you could put up the slide with the Cherry Hill resources with our numbers, that would be great to start with. But I think it's really important for everyone to pay attention to our students' needs, especially when it comes to mental health. Because although as adults, we are stressing in different ways, children's stressors come out in many different avenues. So we just want to pay close attention to what's going on. And I know how hard it is for when we're going back to school, and then they were so excited, and especially for the little ones to get to go to school, and for all the high school students and middle school students, they really wanted to come back, and they had, you know, a little bit of a disappointment for them. And I think it's really good to have the communication open, especially when you're talking about, you know, keeping a routine together, a daily routine. Sometimes that's hard, especially, you know, where, oh, I think I'm going to go to school tomorrow, but, you know, like we just had, and they were really upset. But now hopefully we'll be a little bit more consistent. And even though we're going to have a break for Thanksgiving and we'll have those couple days off, still I feel like try to keep it as consistent as possible is going to be great for us. Staying connected with others. I knew some of the, you know, people in the community have had, you know, their children being able to have some play dates and things like that with the people in, you know, close to them or next door or with family members. But also remind them that there are people to talk to at school. Even if they're not physically in school or remote, they can still contact the school, and we'll be putting that up also. And then just remember to be kind to yourself, to themselves. Remind them that, like, it's okay. There's going to be mistakes. There's going to be things that are happening, and that's okay. And we're going to work together through this. This is nothing that any of us have been through, so no one is an expert. So I feel like just taking it day by day and reminding them to be as flexible as possible, and to breathe, because that's what we're all going to be doing. We're all in the same boat. There's nobody who has done this before. So, you know, we're all there together. Dr. Malash had put up the slide, and I'm sure this will be available to you, but this is all the student assistance counselors. So we are counselors that are in the guidance department, and we assist with students' needs in pretty much mental health and substance abuse. And we're also the anti-bullying specialists. So there's our numbers. We're all at the 3 high schools and at the 3 middle schools. And then we also outreach to the elementary schools. So we all have elementary schools that we liaison to. Just remember also your guidance counselors, there's all in the schools, reach out to them if you need to, the school nurses, and also we have school advocates. So our school advocates can also reach out to you. Dr. Malash, if you want to go down to just the Camden County resources, there's some hotlines in there, but also the Camden County mental health resources. Perform Care is a state resource for you, and it is free to all New Jersey residents. So it's an excellent way to start if you're just thinking about that your child may need to see or talk to somebody. They will do an intake for you over the phone and then decide from there what type of services you may need. And they do, and it is free. So it has been a great resource for us. There's also the crisis intervention services screeners. That's our Camden County crisis. And they'll be able to also, there's a mobile response that can come out to the home. But I feel like if you really need help just getting started, just to reach out to any one of us in the school, an administrator, school nurse, guidance counselor, again, any one of us can help you. But I think it's really important to start the process, especially if you're starting seeing a little bit of signs and symptoms. And it's always good to talk to somebody. Thank you, Dr. Malash.
Thank you, Mrs. DeStefano.
Mrs. DeStefano, thank you so much for your response. It was very thorough. Just to the panelists and to Dr. Malash and Mrs. Seidel, we are currently at 7:45 p.m. We have approximately 45 minutes left for our discussion. Panelists, if you could please keep your responses to approximately 1 to 2 minutes, that would be greatly appreciated so we can maximize our time with getting through participant questions. Thank you.
Thanks, Dr. Mahan. Mrs. Seidel, how long will remote option, this is from Bianca Lassou, how long will the remote option be an option? My child is now remote with cases continuing to rise. I'm not comfortable sending him back to school anytime soon.
So as of right now, there is no end date for the remote option. So if you are not comfortable sending your child in person, you should absolutely continue with the remote option. And as Dr. Malash mentioned earlier, if your student is in a remote option but wants to switch to the hybrid option, please make sure you get in touch with your building principal, as that change will impact the numbers in our classroom. However, on the flip side, if your student is a hybrid student and needs to stay home because they're under the weather, they're not feeling well, or they need to quarantine, that is a switch that you can easily make as well. And a simple note to the school can be used in that scenario as well. But for right now, there is no end date, unfortunately, to all of this. So it's here for the foreseeable future right now.
Thanks, Liz. Dr. Nowako, here's another one that I think is in your area. What are the plans going, this is from Cynthia Ashlock. What are the plans going forward to manage this like we do other illnesses? Will one positive test close down the school for 2 weeks every time? Will there be a threshold at some point that is set?
That's a good question. Yeah, there's a threshold, and it's part of the guidance that I mentioned before from New Jersey Department of Health. One positive case, do not close a school. Actually, one outbreak, do not close a school if it is well managed. Then is to exclude the people involved and manage their close contacts, and then exclude them from the school while the school in-person class will still go on.
Thank you, Dr. Nowako. Another question, Kelly Gasly. Does the school district agree that it would be appropriate at this point to consider a tiered approach that treats elementary, middle, and high school openings differently? So we've talked about tiered approaches since back in the summer and then again in September. Yes, we do believe we need to get kids back into the building and to be able to look at the schools as individuals once we have children in them. There's a question, Nancy Kaminsky, how will the teachers teach to in-class students and remote students at the same time? I know this has been asked before, and you say that teachers are prepared, trained, have the tools. I'm unable to visualize this. I would like you to be more specific, please. For example, if there's a technology issue affecting remote students, will the teacher focus on the technology issue while in-class students wait for it to be resolved? If there are labs, how will remote students participate? If there are group projects, will remote only be paired with remote? How will testing be handled, proctored, remote versus in-class? I don't know whether Dr. Birdie or Mr. Redfern, before I swing at this, do you guys want to?
Yeah, I'll give it a shot and then I'll turn it over to Dr. Birdie. I think part of that's going to be the structure of the class in terms of how, a hybrid model is going to be delivered. Because when you look at the numbers across the district and you look at how schools are different, from classroom to classroom is going to be different as well. So you may have a cohort A, for an elementary school where there's 7 kids on one day and 1 child on another day. So it'd be safe to say that, a teacher would be able to manage a lot easier with 1 child in person and the rest at home, or vice versa. I think a lot of it's going to be, getting in and going through the first, probably I would even gather to say 3 or 4 weeks, and for a teacher to start to establish a routine for themselves. Because that has been something that has been not just in Cherry Hill, but across other districts in New Jersey, that teachers have said, they don't want to feel as though that the kids at home are feeling slighted because more focus is on the kids in the classroom or vice versa. So I think that becomes, the skill of the teacher, the practice of the teacher, and then also working with their colleagues to be able to, iron out, if I'm a first grade teacher, talking to my other colleagues and saying, I feel like, this isn't working or that's working, and support each other as they move forward. I don't think there's a right answer or wrong answer because it hasn't been done yet. So once they get in there and they start doing it, and obviously administrators will support, that work. I know teachers have done dry or test runs, with the technology using themselves. One teacher will go to one room and be a remote student. A couple teachers will stay in the room, and some of the technological issues have been ironed out. But again, technology is a beast of its own, and sometimes we can't control it. So, but I think that our staff will do the best that they can. They've always have, and they will continue to do that. And I'll turn it over to Dr. Birdie if he has anything from the middle school perspective.
Thanks, Steve.
Thanks, Steve. And I do. And I think that Mr. Redfern is totally right. I mean, to the teachers' credit, they've been amazing in not only asking for, but fully immersing themselves in professional development directly related to teaching in the hybrid model. So it's something that we focused on really since September with collaborative afternoons, with in-service days, with faculty meeting time, where the teachers have really focused on how to engage all learners, whether in person or remote, synchronously, and really how to deliver high quality instruction in a model that that none of us have ever taught in before. So really the teachers have been asking great questions, and I like to believe that we've been providing them opportunities to polish their skill set and really sharpen their saw. And to Steve's point, teachers have absolutely been piloting the hybrid model within the buildings. We know that teachers were acting in role of both teacher and learner and running hybrid classes throughout Carusi just last week, just to see what it looked like, not only as the teacher in the classroom, not only as the live student, but also as the students who are dialed in remotely. So I would concur that the teachers have been amazing in really diving deep into the PD that's required. Their intentions will be perfect. We will not be perfect, but our intentions will be, and I would assume we'll continue to learn and grow, over the next few days and over the next few weeks.
Excellent. Can I just ask a follow-up? Thank you, guys. I appreciate that. Can I ask a follow-up? A question that came from Madeline Boning, a parent. It says, in the hybrid model, will students spend their in-person time on the computer, or will they engage in learning that does not require technology? Give an example of science lab experiments. And then what safeguards have been put in place to limit cheating on multiple choice tests?
Those are both great questions. I would let me start with the second one first. I think there's a fidelity question about potential academic honesty. Teachers have never used a single stream evaluation or one data point to assess neither growth nor proficiency. So I would assume that teachers will be using lots of metrics to measure student grades and student growth and student proficiency. So for instance, I'm assuming that in every case, teachers will be working in small groups with kids, and they'll understand exactly what their strengths are and where their deficits are. And as always, they'll focus more on feedback than grading. So I'm not hyper concerned about the fidelity piece. In terms of in-class instruction and what that looks like, it really will depend. I do think that there will be, for sure, screen time or computer time within the classroom. It's certainly one way to make sure that both remote kids and in-person kids are receiving, articulation and what's deliverable to them. But I assume there'll be in every class. I think science was mentioned specifically. Opportunities for multiple intelligence to be included and really delivery in a multitude of ways.
Thanks, Dr. Bernie. All right. There are a number of questions that came through about, and I'm going to just kind of encapsulate them together, about should we wait until after Thanksgiving to bring students back? And then along those same lines, if people are together or are traveling over Thanksgiving, should we wait until after winter break to bring students back? Should we wait until 2 weeks after winter break to bring students back? At this point, as you're aware, we are launching with the hybrid tomorrow. We are moving forward with that schedule. We are encouraging everybody in our community, from our staff to our families, our students, to observe and practice the mitigation of trying to limit exposure, wearing masks, not being in large gatherings. This is something I know that there's a lot of family discussions that are going on in town right now about, what does the Thanksgiving holiday look like? What does that weekend look like? Are people traveling? Are there extended family people getting together? As of today, we're going to be continuing forward with our hybrid schedule and working with Dr. Nawako and his team as we monitor and see what's going on with cases within the community. There's a question from Peter K. Has each school gone through ventilation modifications prior to bringing back the students? Will there be any cleaning throughout the day during passing? How does school officials direct the students so there's no overcrowding in the hallway? Will there be hand sanitizer stations throughout the school? If so, please provide a complete floor plan identifying the locations. So let me work backward in the question. There's hand sanitizer in every classroom and in every instructional space and at the doors. It's available. There are wipes that'll be in every classroom for wiping desks as well. The practice of what does it look like movement in the hallway to maintain social distancing is something that our staff members, our administrative team, and the people, our support staff that work in the buildings will begin going over with students beginning tomorrow. It's one of the reasons, especially at the elementary level, as we look at the first couple of days, that it's just going to be just the students in school for the focus for the first hour. So they can talk about what does movement look like in the school? How do we get from spot to spot? What does it mean to maintain distancing? That's going to take practice. That is going to take work. I can tell you, having been out in the community and been at some fall soccer games and some other events and outside, that's something that we all should be practicing better, and all we can be going over practicing with our kids when we are at other events. There will be cleaning that will go on throughout the course of the day, high touch areas, additional misting for disinfecting. There's not been widespread modification to the ventilation systems throughout the district. There has been incredible amount of cleaning that has gone into the ventilation systems, checking on the filters, changing the filters, making sure that they are operational and that there is the exchange, an appropriate exchange of air that is taking place. There's a question, Jonathan Rain, parent, when are we returning to having a full afternoon of virtual instruction for elementary school students? If a subset of parents have concerns about excessive screen time, can they be allowed to opt out of the afternoon instead of unilaterally depriving the entire district of 30% of the school day. The discussion to make an adjustment with what the remote learning day looked like is something that took into consideration staff members, community members, family members, and students and their feedback about what did it look like from 9 a.m. to 3:30 p.m., the value of the time, the quality of the time of instruction. When the committee had the opportunity to get together and talk about the recommendations that came out and to hear the authentic feedback about what it was that was taking place, that's when the recommendation came through to make the adjustment to the schedule. We will continue to look at that schedule. We will reconvene that group because again, they are the experts and the practitioners to look at what actually is taking place in terms of the value and the quality of the instruction that's going on, that type of feedback that they're getting from the children. We will continue to monitor that. That is something that this group will look at throughout the course of the year.
Dr. Malash, thank you
Yes,
for
Dr.
that
Mahan.
response. Thank you for that response and highlighting the work of the Return to Learn Committee. We had over 80 individuals participate in helping to ensure that our students return in a hybrid model. This is a reminder that it is now 8 o'clock.
Thank you. Thank you, Dr. Mahan. Dr. Nowako, here's a question down along the Department of Health. Came from Jennifer San. It says, if your child is in a class with a mask on and socially distanced and another student tests positive, is the entire class quarantined regardless of measures in place? Can you just give us the perspective from the Department of Health?
Thank you for that question. If we let all the school know that they have to have the sitting chart for each classroom. So with that sitting chart, we will determine the positive case, and then we will have to exclude the people are sitting around that positive case. So we tend not to exclude the entire classroom. So far, they are social distancing and they're wearing masks. So I believe that answers the question. But if they're all packed together into the classroom, if one person is positive, then we exclude the entire classroom. Yeah.
Thank you, Dr. Nowako. Dr. Nowako, here's another one from David Jacob, who's a community member. And it just says, if current trends continue and cases continue to rise, the question is, how does the district plan to react? Can you just talk about if you are anticipating anything at the county level and guidance that you are helping to provide us with?
As of now, the guidance that we have is the one from New Jersey Department of Health, and that's what we follow. It's in segments, and it will tell you what to do if your case, if the case in the school spikes. And you have to understand that there are other school districts that have gone from in-person or hybrid to full remote because of the cases in those school districts. Just for you to be aware of that. There are no hard and fast rules. It's a decision that the school district will have to make based on their individual situation and the number of cases in the schools.
Thank you, Dr. Nowako. Here's a question, I think Dr. Birdie, this might be along, it mentions Carusi, from Jerry Lerman. Why can't middle schools like Carusi follow an elementary school model where the students remain in the same classroom the whole day and the teachers move from classroom to classroom?
So yeah, another great question, and I think I mentioned it in one of my earlier responses, regarding what mitigating steps we've taken at all three levels to help reduce the risk of transmission. If you don't have any schema on how schedules are created in schools, I can sum it up relatively easily by saying it is all about competing priorities and values. There's certainly a need when you create schedules to look at obviously what children need in terms of courses and in terms of IEP and 504 programming, in terms of homogeneity and heterogeneity, in terms of social and emotional learning and class combinations of students and teacher personalities with the needs and strengths of children. So there are just so many competing priorities and values when you create a schedule over the summer. And this summer, we were directed very clearly to value and to place a great deal of value on limiting transitions, essentially allowing students to remain sedentary, to keep them in one location and to move staff. So I can tell you, having worked closely with the two other middle school principals, that's actually something that we focused deeply on over the summer and really worked to perfect that in many ways in August and into September as we prepared. Now, with that being said, regretfully, due to IEP and 504 compliance, due to related services like speech, OT, PT, for off-team math, when you talk about leveled math in middle school, when you talk about music lessons or instrumental and chorus opportunities for students to experience the arts, it is a virtual impossibility to run it in a self-contained way like the elementary schools do. But I can assure you that we have vastly limited the amount of transition students make. And we've remained in compliance with IEPs and 504s in the meantime. So we did value that over the summer. And we continued to focus on keeping children still as much as we possibly could, while still honoring all the other competing priorities we have.
Yeah, about quarter after. Thank you, Dr. Birdie. Here's a question from Jessica Anthony, a parent. There are a number of questions that come through. Let me just address the beginning of this. There is a need for more data sharing. Why does the district not yet provide a dashboard, in quotes, of information relating to cases, transmission, status of quarantine, status of school building closures, broken down by school and updated weekly? And will this be provided when hybrid starts? We are taking a look at some different dashboard models that exist. We've been reticent to do that in the beginning because there were so few cases, and we did not want to individually single out staff members or students who may have been affected. But we are taking a look at a dashboard. We still have had some questions we've gone through about confidentiality of information. There's a question from Rachel Weinstein, a parent. I'm concerned about encore teachers pushing into students' classroom. Doesn't this increase the amount of exposure to not only the teachers, but also the children? I'm worried that the increased exposure will lead to hybrid students needing to quarantine sooner and more frequently. Has the district considered having encore be virtual to ensure that the students can remain hybrid longer? There's actually been a number of discussions that have taken place since last summer and then through the course of this fall about the encore teachers at the elementary level. For those who are not familiar with the vernacular, encore would be your music, art, physical education, library, teachers like that provide additional learning opportunities for students. The determination with how the encore teachers are used, is again, as long as the mitigation practices are being followed, the social distancing, wearing the mask, covering the nose and the mouth, washing hands, appropriate hand hygiene, and limiting contact is what we are looking at, in terms of their practices. The encore teachers have been incredibly creative in lessons that they have prepared, both in virtual, because there have been virtual encore lessons that have gone on since last spring, and for the in-class lessons, because there certainly has been a change in practice with what they've had to do. It's a question from Julie Lerman about when will the public be allowed to attend Board of Ed committee meetings remotely? This was allowed prior to the pandemic. Not providing public access does not demonstrate transparency. So for the Board of Ed committee meetings, the only time that we've had public participation or attendance is when they've been in person. We have not broadcast. This has come up as a discussion a number of times. The board has reiterated the fact that we do not broadcast them because it is not the full board. So until the full board can receive information and the recommendations that come from the committee, which happens at the work session, which is typically the second Tuesday of the month, is why we do not broadcast the committee meetings. Answer that. This question, Melissa Bush, is the district considering implementing a plan in which only children with IEPs return to in-person instruction? If not, why not? These children are never mentioned specifically by the district. So again, right now we're trying to get everybody back into the district. As I talked about, some of our most vulnerable learners, which would include children with IEPs, specifically children in specific classes, will have the opportunity to attend school for 4 days during the course of the week. Again, those classes are specifically ones that are listed. Those children in Genesis are listed as cohort A/B to denote that they are in school 4 days a week. We want to be able to provide the in-class and in-school opportunity for those children to have. So, question for one of our students, Nick, I'm not going to give his last name. How will Governor Murphy's newly announced executive order affect the rollout of hybrid learning, the hybrid learning model? So the governor made announcements today about people that could be inside and outside gatherings. We have not yet received guidance from the Department of Education. Typically, as this has happened since last March, an announcement will come from the Department of State or from the governor, and then it will go from there to the Department of Education, and then we will receive guidance after that. So we have not yet received that information. Pamela Barroway asked a similar question. Ed Dodd asked, please provide the number of staff members currently positive for COVID who are quarantining. HIPAA doesn't prevent you sharing raw numbers. So currently we have 1,702 employees in the Cherry Hill Public School District. Out of those 1,702 employees, we have 11 positive cases of COVID currently. We have 12 staff members who are currently out quarantining, waiting test results, who have tested. And then we have 12 staff members who are quarantining due to possible exposure. So 1,702 staff members, 11 who are positive, and 24 who are currently out, either pending test results or are quarantining because of possible exposure, and a combination of possible exposure at work, 4 of them, and 8 of them who are exposed someplace at home in their personal life. There's a question about Jill Gazzarano. Please discuss what will happen if a teacher gets COVID. Obviously, they'll be unable to teach even remotely while recovering, which may take weeks. How many substitute teachers are there? Would there still be synchronous learning with a substitute teacher, or what is your plan for that scenario? We are still, well, 2 things. One, we've had jobs posted. We are in the process of trying to hire long-term subs. We have a cadre of long-term subs who are with us through the end of the academic year. If you are interested, please make sure you go online and fill out the application. Contact me directly if you need for assistance and guidance in that. We are also still working with Source for Teachers on bringing in daily subs. We have additional staff in buildings who will help to provide support for classes should that be necessary. We've also reached out to many of our current students, graduates who are in college. 60 college credit students are eligible for a substitute certificate. Again, if you have questions, let us know. Mrs. Wilson has posted information and you can find it online. And then one more from this list of what came through from Jim Cox, who's a parent. What measures are in place to keep 6-foot rule in common areas such as hallways? In addition, is there a way for president to monitor the hallways so we can see if crowding is an issue? Many students in the building for PSAT state they were not 6 feet apart. So again, reminders, monitoring of staff that are in the building, practicing with the students and going over what those guidelines and expectations are. Right now, there really is not a way for the public to monitor that. We haven't been able to monitor because the kids have not been in the building. We will be able to monitor that, work with our staff and work with the folks who are in the building. And we will continue to remind students. It's a great reminder and something great at home. Families, please make sure you continue to remind your kids. Mrs. Seidel is going to go over if you'd like to ask a question online or raise a question. I know that there are a number of folks that already have their hands up. We're going to spend about 15 minutes if we can in taking a handful of these questions.
Okay, great. Okay, if you'd like to ask a question, please click the raise hand button in the bottom bar of the meeting, or if you're dialed in by telephone, you can dial *9 to raise your hand by phone. We'll call on you by name or by phone number, and then a prompt will show on your screen asking if you want to unmute. If you're joining by phone, dial *6 to unmute your phone when prompted. And then we're going to ask that you please limit your question to under 3 minutes so that we can get to as many questions as possible. Okay, so I will start with, and I apologize if I pronounce a name incorrectly. First name Giselle, last name starts with an F. Giselle F.
And Giselle, you should be in and able to unmute yourself to speak.
Hi, my question is, if a child decides to, change from hybrid to remote, and based on family's current situation, and then decide that, maybe in a month, their situation changes and they want to go back and allow for the hybrid, when can that decision be made in the middle of things?
Yes, so always you can contact the building principal if you have questions to find out about what's going on. And certainly we know the life situation changes for families and needs change for families as it's going on. So you'd always make direct contact with the building principal to have that discussion.
So another thing is, like, I didn't understand your answer to if a teacher gets COVID, and for example, the children that are in that classroom, well, that means that the students in that class will also have to be out until the teacher recovers? Or is that all based on the plan from the gentleman that said, based on where they're sitting, their proximity to the teacher, will that also be applicable?
Dr. Nowako, do you want to field that?
Yes, you're correct. It all depends on the seating chart. Usually the teachers sit in front of the class or sometimes at the back of the class. So we look at the nearest student from the teacher, and we exclude that student or the students if they're not 6 feet apart from the teacher.
Okay, thank you.
Thank you.
Thank you. Next, Alan Shepard. Alan, just need to unmute your line. All right, we'll come back to Alan. Eric Brenner.
Yeah, how you doing? Thanks a lot. Appreciate everybody's work and effort on this. My question is for Dr. Malash and the district. Why does it seem like the district is responding reactively instead of proactively here, given the handful of date changes that have been made over the course of the last couple of weeks?
So Eric, thank you for your question. So we have a very well and overdeveloped plan that we have ready to implement. Unfortunately, there are some pieces that are going to be reactionary based on the information that is shared with us when we deal with and work with the Department of Health. With the size of our district, 19 schools, little less than 11,000 students and 1,700 employees for whom we are responsible, it is tough to make very large and very wide sweeping generalizations with things. So we want to be able to do the best that we possibly can for all of the students that are involved. And for some, that means we can get them into the building so they can have direct instruction and have that contact in the building, then we want to be able to do that. But we take the information as it comes forward.
Yeah, thank you. And just one quick follow-up. As things change and for parents across the district, these quick decisions to change the timelines and close everything, if it does come to that again, how do you anticipate letting parents and families know as far in advance as possible that there will be another shutdown?
Good question. So ideally, we would like to let people know as far in advance as we possibly can. Again, a lot of that is dependent upon the information that we receive and what's going on within our community. Our school district becomes a reflection of our community and what's taking place in Cherry Hill, which is a great thing and at times a challenging thing for sure. We are not in a place yet as a district, and there are some surrounding districts that have made the determination at the beginning last week that they're going to be closed until January 19th. We have not made that determination that we are in that spot yet, or that we need to make that decision right now. All parents, all families have the opportunity to choose full remote for their children. They've had that opportunity from the beginning of the year. They will have that opportunity through the rest of the academic year for the child to remain on full remote instruction.
Thank you.
Thank you. Next, Amy Demerjian.
Hi, first, thank you for taking the time to share all this information with us. Recognizing that there's going to be a learning curve for all of us when we return back to school. Once that period, whatever that might be, goes, if a parent or a student feels that there's some form of inequity between the hybrid and virtual learning experience, without causing any hurt feelings or anything like that, what would be the next steps? Because certainly if I was being questioned, I would perhaps have my defenses up. So what would be the appropriate channels and next steps should there feel that there's some kind of inequity, and how we could help the teachers and students have a better experience?
So the first place always, if there's a question about something going on in class or a class experience, honestly, you should go to the teacher. Again, the teacher is the expert. The teacher is the one that's directly involved, that's there. If there's a discomfort with that, if the student or the family is looking for additional support, guidance counselor, SAC counselor at any of our secondary schools to go through, principal, assistant principal, always, but I would tell you to start within the building. The teacher is always going to be the best resource. The teacher is always going to have to be involved in the discussion. If child or parent goes to the SAC counselor certainly is going to speak with them, give advice, and then reach out to the teacher, because the teacher is going to need to be involved because they're the ones that are there. And sometimes there are challenges that exist. The teachers, I will tell you, to a person, want our children to be successful, and they want to make sure that they're doing what they can for the kids to be successful.
Understood. I agree. I mean, when we've ever emailed teachers, they've been very responsive. Just figuring, I'm thinking about human nature, so I wanted to put that question out there just so that it was fielded.
Absolutely, good question.
Thank you. I'm going to go back and see if Mr. Shepherd is available now. Okay, Shannon.
Mrs. Seidel and Dr. Malash, it is now 8:22. We have approximately 3 minutes left for questions from online participants.
Thank you, Dr. Mahan. We may try to go to 8:35 with questions to stay within our window, but go just a little bit over.
Shannon Gross.
Hi. I wanted to just point out that for those of us with hearing loss, this format does not have captions and has been almost impossible to really get the full information. So, and in addition, I know that for obvious reasons, some of you need to be masked if you're in the same room with others, and I completely understand that. I would just encourage you to see if there are other ways to do that so that we can also read your lips and get the information in an equitable way. But short of that, is there a way that we can get some sort of transcript of this for this particular meeting, or if it was recorded? It was on YouTube, but apparently the captions weren't working on that either.
Shannon, thank you for your question. We've just started to use Zoom, and we are still trying to work out what the live closed captioning looks like. This will be archived and will be on YouTube. Once it's archived, the closed captioning should absolutely work. And we expect, again, it takes a little bit longer for it to transition into format for YouTube, but we would expect by tomorrow afternoon, it would be on our YouTube channel. Thank you for sharing that. We are working on it. I'm sorry for the challenge that you experienced.
Thanks. Just so you know, the Google Meet does caption.
Google Meet.
So yeah, the Google Meet and also the Microsoft Teams uses caption. They both have captions available. So yeah, just another option. I appreciate your help.
Yep.
Thank you very much. Next, Lisa Davis. Hi, Lisa. We just need you to unmute if you're there. All right, we'll come back. Next, there's no last name, Philip. Okay, Liam and Alex.
Yes, thank you very much. This is Michael McGonigal. I have a son in second grade in Clara Barton. First, I want to thank everybody for the concerns about our children and their safety and the safety of the teachers as well. Dr. Malosh, my main concern is how are we evaluating the quality of the education that our children are getting right now? as opposed to a normal school year? And going forward, what are we going to expect on that?
Dr. Birdie, you want to talk a little bit about that with report cards, experience? Mr. Redfern, either of you two guys first?
I'm happy to just start us off a little bit, Dr. Malash. So thank you. What we're really working with is not what we've experienced before. I mean, it would be impossible to emulate in terms of delivery of instruction, assessing instruction, providing feedback, measuring growth. The way that we did on March 12th or on March 13th, when our changes occurred and we moved from in-person instruction to remote. I would hope that a move back to hybrid, tomorrow and bringing kids back into the building is really the first step in thoughtfully working through some of the growing pains we've experienced with not being able to assess kids in person, not being able to deliver live instruction face to face, not being able to pick up on the idiosyncrasies of students and take advantage of those teachable moments that our faculties are so good with. In terms of content, we're still attempting to follow all of the New Jersey learning standards. We're still attempting to deliver content in alignment with the scope and sequence, but we certainly recognize, like Mr. McGonigal does, that it is different. It's different for my kids in their schools, and it's different for the children that are attending Cherry Hill Public Schools. But we continue to evolve and grow, and I think we're in a much better position than we were in September, certainly a much better position than we were in May. And I anticipate in December and January, we'll continue to evolve and grow, and we'll be in a better position than we are today.
Yeah, I would just add what Dr. Birdie said at the end there. I think that, when you look back at the spring compared to now, I think we are definitely in a better spot. And I think the ability to, facilitate learning and also present material, et cetera, is much better than where we were in the spring. And I also think that, teachers will be, and I've talked to a few, and I know that this is starting to happen, within, their groupings, whether it's, second grade teachers or whether it's a department or whatever, that are starting to have those conversations about assessment. And I think when they're talking about it and discussing it, it's a lot easier to start to, again, facilitate back and forth with each other about exactly what, assessment can be. What could we do within, the math department, or what, as second grade teachers, what are we all doing, to make sure the kids are learning? So I think those conversations, are beginning to happen, and they'll happen even more, as Dr. Birdie said, once we start moving through the hybrid. But I'm confident that teachers have that on them, and they're thinking about that as they move through the process. It's just a matter of, getting again through these first couple of weeks of transition again, and starting to have, those conversations of what it looks like a week from now, 2 weeks from now, 3 weeks from now, when we start assessing, we start looking at the elementary level, report cards and parent conferences. I know Dr. Birdie's already gone through, an end of a marking period, so to speak, but, those conversations continue. And I'm confident that, the staff and working with the administration in each building, we'll get to a point where we know that, learning is occurring, and how are we assessing it, and how are we making sure that students can improve on a daily basis.
Thank you, gentlemen.
Thank you. Next, Joshua Almonte.
Nice.
Hi, good evening. We were wondering, I'm not sure if you guys discussed these earlier on, but what kind of steps are being taken? How are the classrooms, the school, the bathrooms, and all the high touch areas being sanitized? And what kind of products are being used?
Yes, ma'am. Thanks for the question. I don't have the list off the top of my head of what the products are. If you send me an email, I can provide that for you. I know that we have put that out there before. We've actually changed the structure and the organization of what cleaning looks like in our building for our custodians during the day and for our cleaners at night. There is a chart that they follow that has specific tasks that are done throughout the course of the day, broken into 15-minute increments that are there. We use the electrostatic misters to use as disinfectant is used during the course of the day on the high touch areas, door handles, switch plates, the bathroom doors, things like that. And then is used in the classrooms every evening. It's the last thing that is done in every one of the classrooms and in offices in the building. So as they're misted, and again, it's electrified, the mist attaches itself, clings to the desks, and then it evaporates in a disinfecting sense. But we started back in the spring with sourcing these materials, making sure that they were COVID compliant and that they were appropriate for use in our schools. We also had the custodians, our head custodians continued to work throughout the course of the spring. Our cleaners returned to work before most other staff. So we have a lot of time. We've had to have a lot of time for training and additional review. And we've just done additional training again this fall about how to do things and how often it has to be done.
So would it be done in between classes, like after a group of students leave the classroom, then they come and clean, and then a new group of students will come in?
Now, so in classrooms, but there'll be tubs of wipes in every one of the classrooms. That's one of the things we'll go over with students. So students will learn how to wipe their own desk off with the wipe, as they are getting up to exit. Similar to what we have kids do when they are in the weight room, when they practice in the aerobic center in many of our schools.
Thank you. Gina Liu. Gina Liu.
Oh, hello. Can you hear me?
Yes, Gina.
Oh, hello. Again, I'd like to say thank you so much for your time. I really appreciate it. I'll keep it short. So for the high school, especially at East, a lot of the people are saying that the schedule, while it's nice that it starts later, there's really no break time in between. And I understand that we can't take our mask off legally by a state, but are there any considerations to maybe implement a break time just so that students, maybe at least remote kids, can get a snack and eat before their next two classes? Because it does definitely impact our learning and education.
Gina, thank you for your question and thank you for being involved. There will be times during the course of the day, even at the high school, this is something I know that Dr. Perry at High School East and Dr. Morton at High School West have discussed with their staff. We've told students they can bring bottles of water with a straw, they can bring dry, nut-free snacks, and they will talk to students about when those can be consumed during the course of the day. In order for a school day to count for us in school, it has to be at least 4 hours of instruction. We had a big discussion when we adjusted the high school schedule, because normally an early dismissal day for the high school would be 7:30 a.m. to 11:45, which would not include lunch. Pushing the schedule back to start at 9:45 and to end at 2:15 still allows for those 4 hours of instruction, as well as additional passing time between classes, but still does not provide that opportunity for a lunch period during the course of the day. So they will go over in school about what does it look like to be able to have that snack. There's courtyard spaces, but they will go over that with all of y'all in school.
Okay,
Mrs.
thank
Stefano's
you.
nodding her head because I know they've talked about it in the meetings and in the correspondence that's gone out from High School East.
Thank you, Gina. Yeah, next, this is going to be our, we have time for this one last comment. Stacy Henderson.
Can't, not allowing me to let her to talk. Ooh. It says she has an older version of.
Oh, we're getting an error that we can't allow you in with your version. All right, so we'll go to Melissa Vitelli.
Hi, thank you so much. I know that Dr. Birdie mentioned the teachers have been preparing to handle teaching the students in person and virtually at the same time. I know the teachers have been doing an amazing job and I have deep admiration and appreciation for them. But I'm wondering why we're not following suit of other districts and having teachers specifically designated for just remote or just in person. I think it's just unrealistic and unfair to ask of the teachers to do both. And I just think the quality of education won't be as good.
Thank you, Ms. Vitelli. So it is something that we've discussed. In fact, it was something that we discussed during the summer and then in the course of the fall after we've been on the full remote instruction. One of the challenges that we have in Cherry Hill in implementing a schedule such as that, that some of our neighboring districts do not have is literally the volume and size of how big we are, which means at the elementary level, when you look at the number of children who are on remote or the number of children who are on hybrid, to start to pair those students up so that you could have a full remote class of 22 students or 24 students, we would need to start to put students from different schools across the district together into a class, which would then relegate those students to being in that class for the most part for the entire year. When we get into the specialty areas at the secondary level, same thing. We start to run out of teachers and we start to run out of appropriately certified folks that can take on certain classes. The volume, because of the nearly 11,000 students that we have here, is one of the things that became a very big hurdle for us to try to make that work in a way that provided some sort of semblance of order and continuity for children, for families, and for the staff members. It's one of where volume of scale was not our benefit.
Thank you. If it's not working out though, once it starts, will there be some kind of change or plan?
Say it one more time, Ms. Vitelli, I missed the beginning of what you said.
Well, just if school starts with this model and it's not working out from both sides, if both hybrid and remote families feel like instruction has deteriorated, is there anything else that can be done? Like maybe getting more teacher assistants where the teacher and the assistant can swap off during the day?
Good question, Ms. Vitelli. So what I can tell you is, yes, we will continue to look at the effect that the implementation is having. We will take feedback from the folks that are on the committee. Dr. Mahan, who's our director of curriculum, who's been on a couple times, has talked about the 80 people, the 80 plus people that worked on the committees that represent, nearly 1,000 certificated staff members. We get a lot of feedback, both from staff and from parents. Those committees will continue to meet and to revisit the information and the ideas. And now that the buildings are all involved in the implementation of the schedules, same thing. They will discuss at faculty meetings. They will discuss during their PLC time. And if stuff's not working, we want to fix it and make it better. There's no reason for us to go through months at a time or the rest of the school year and say, well, if we could have changed it, it might have been better. We want to talk about it and see what it is that we can do. I anticipate that we will continue to get feedback from folks about what it looks like. Again, I talked about it, Mr. Redfern talked about it. The one thing that I do ask, especially as we start with this hybrid launch tomorrow, is that there is patience and grace for our teachers and for the children, right? It's going to take everybody time to get used to what this is going to look like and the combination of students at home, the combination of students in school at the same time. So we want to make sure that we provide people with that opportunity to move through this. Those of us that work in education all the time, it's one of the beautiful things we have the opportunity to see as classes grow and come together during the course of an academic year. And sometimes lessons don't go really well. That just happens, right? For a variety of reasons. And then we regroup in a classroom, we talk to the kids, and we find out why, we find out what could we have done as teachers, what could they have done as students, and then we improve it and we move on, right? Learning and education is about making mistakes. It's about improving, it's about learning from those, and it's about moving forward. So as we come to the end of our discussion this evening, this will not be the last of our town hall meetings. I do give credit to the board and the board leadership. As we've had the discussion over the course of time, you will see additional town hall meetings that will come up between now and the winter break, and from the winter break throughout the spring, the rest of the winter, and then through the springtime. Now that we can manage a model such as this, we'll continue to try to do that. Folks, again, I'm incredibly thankful for our staff members, all 1,700 of them. If you have the opportunity and you run into one of our school nurses or one of our custodians or one of our educational assistants or secretaries, please thank them for what they are doing. These people have been so incredibly dedicated and giving of themselves. And there is tension and anxiety in what they do, and they feel an incredible amount of pressure because they want the best for our children, for the children in our community on a daily basis. If you did not get a chance to ask your question, please send it to us. I'm going to put up on the screen, we are going to launch a thought exchange this evening as well. It's fine, so I can get this up here. This information will also be coming out through our social media. It'll be on our website, but you'll be able to see this thought exchange. And what the question says is, now that you've heard the questions and answers in our virtual town hall regarding hybrid learning, what are your thoughts or additional questions? You can certainly go through the thought exchange and share them. It'll be open through, I believe, Friday evening. You can always email us. If you have questions specifically about something going on in your child's school, please contact the school. It's about a classroom, contact the teacher, contact the principal. Our nurses, our counselors, our child study team folks are incredible resources for information. I appreciate everybody spending the last hour and 40 minutes with us. Thank you for being with us, and we look forward to seeing you all soon. Please stay healthy, wash your hands, wear your mask, maintain social distancing, do not be in large mixed groups. Please follow the guidelines. We can all make a difference for our children. Please, please, please.